Okay, so in this next series, I'm going to be talking about how to help somebody in bed, how to turn them in bed, and the easiest way for a family member to assist them once you have put them in bed. An easy technique is using a bed sheet. You fold it, so it really depends on the person's size, but you can use a sheet, or you could buy one, or a towel, something that you can use that's flat. So essentially you're going to open this up, put it kind of lined up like with the shoulders and to like knee level of the person, and then what you do is you just lay it nice and flat so that you could use this to assist that person to turn, especially if you need to help somebody with getting dressed or changing their depend, if they're incontinent. So before we go any farther, I'm going to also show how to go from a wheelchair into the bed. I have the gait belt on already, and so here my husband is using the gait belt with good body mechanics to turn, and I am helping with my hands as much as I can to pivot. At this point, I personally still have back pain, but we're just demonstrating how he was helping me so you guys can learn some techniques. Once you're at the edge of the bed, the person helping can grab the knees and help you scoot back into the bed so that you're not close to the edge. And obviously it depends if the patient in this case, has the upper body strength to assist with the scooting. Now, before you lie them down, you want to be able to get the belt off so that you don't have to struggle getting it off once the person's already lying down. So once you get the belt off, you can go ahead and turn the person from sitting to side lying. So here we're demonstrating how you put your hands with good body mechanics, one over the shoulders, upper back, and one under the knees as the person's lying down. Again, this is demonstrating somebody with back pain. Any move, depending on the severity, will exacerbate the pain. Now, once you're lying down on your side, if you're going to turn the person, if they're a back sleeper, this is how you use that sheet. You lift and turn, and it's a lot easier for both the patient and the caregiver. I personally couldn't tolerate sleeping with my legs flat, so I would put pillows under my legs to assist. If that's not enough, you could put 2 pillows, which is what I was doing. There were some nights that I had to put 3 pillows to really keep my lower back more neutral, and so that's how we did it. You could also position the person's head so that the pillow is outside of the shoulders, and at this point you just make sure the person's comfortable, and then to take the pillows off, you lift the legs, get the pillows out, and you're going to use that sheet again to turn that person the other way. But before we get up, we're going to demonstrate how to position a pillow when sleeping on your side, because I personally am a side sleeper, so I would change positions and my husband would help. So you use the sheet to pull towards you now, because everything has to move as one, especially if your back pain is very severe. And then you can scoot the person's hips back the way my husband just demonstrated. You put a pillow between the knees as well to keep the spine in a neutral position. Make sure the pillow is between the knees and ankles, ideally. And then so that your upper body doesn't turn, you could put another pillow in the front to kind of prevent you from turning. And you can, if you want to be, extra, you could put a pillow in your back as well. But this is how I was sleeping during that time, and I still do till this day, and it's been 3 months since my back injury. Now you take the pillows off, and if you're already in your side, then you just have to sit. But if you're not on your side and you're on your back, you just have to be turned into this position. And then all you want to do is, the caregiver, they can use a sheet to pull towards the edge of the bed so it's easier on their back. And then you grab the legs at the same time as you put your hand under the person's shoulder, upper back area, and you lift them up at the same time as you turn their legs off the bed. Now, once you're sitting, depending, there's some people don't have very good sitting balance, but I do. But obviously, you might have to plan ahead and put the wheelchair next to you, have the gait belt ready. But in this case, I have good sitting support, so my husband's putting the gait belt on me, getting ready to put me back in the wheelchair. And we're going to demonstrate that transfer as well, going from bed to wheelchair using the gait belt. We will be demonstrating 2 ways, one using the gait belt and one not using the gait belt. I personally have a bulging disc, so decompression of my spine really alleviated my pain during transfers. So he would use the belt to help me pivot into the wheelchair, but he would also decompress by pressing into my ribs a little bit to like lift some of that compression I was having. But here you could see I reach to the farthest armrest of the wheelchair as he helps me pivot into the wheelchair and slowly lowers me down. And obviously I assist as much as I can with my hands. Now this is the second way. If you don't have a belt, you just put your hands under the person's lower back. Here he's decompressing my spine at the same time to alleviate some of that pain. And I'm holding on to his shoulders, being careful not to hurt the person's neck, obviously, to really alleviate some of that pressure in my spine. And that is pretty much it. I hope this was helpful. And if you have any questions, please don't forget to put them down in the comments. You could like or subscribe. Thank you.